to record, Vicky?
Yep, I've hit record. Yep.
Great. Hello, everybody, and welcome. I'm Anita Jones. I'm a consultant geriatrician in Sunderland. I'm also an IMT training programme director, and I co-chair the IMT advisory committee. I share those two roles with Jane Wallace, who's our first speaker today, and Jane's going to give us an overview of IMT. Our second speaker is Stephen Harding, who's a recruitment expert, and then we have three trainee speakers, Hannah, Paula and Lydia, who are going to give us an overview of IMT and IMT recruitment from a trainee perspective. I'd ask if you could add questions to the chat bar.
Anita, you've just muted yourself.
Oh, I hadn't moved, but there you go. I'd ask you to add questions to the chat bar, and we will answer them as we go along, and also at the end. This is being recorded, and it will appear on the JRC PTB website at a later date for future reference. So without any further ado, I'd like to introduce Jane, who's our first speaker.
Hi, so welcome. I'm Jane Wallace. I'm a geriatrician in the northeast of England, in Northumbria, and as Anita says, share two of my training roles with her. So it's great to have so many of you joining us, and we're really pleased that you're thinking about applying for internal medical training. And this webinar will be helpful if you're applying this year, or be helpful if you're applying in future years. The main reason we're doing this webinar is that IMT is now competitive. So you need to do well on your pre-interview score to get an interview, and you need to do well on interview to get a place. So this is about trying to help all of you get an interview and then do well on interview and join the internal medical training program. We have many hundreds of trainees this year who didn't score high enough to get an interview. So it is really, really important that you do everything you can to maximise your interview score. And we've got three trainees who are going to tell you lots about IMT, how to maximise your interview score, and how to do well on interview. So I hope you're going to get lots out of it. I'm not going to speak for very long. There's a few little things I want to cover. So firstly, a little bit about the programme. So there's absolutely masses of information on the JRCPTB website. So that's the Joint Royal College of Physicians Training Board, and loads of information there about the programme. So any of you who are considering applying for IMT, I'd really have a good look at that. There's a few things about the programme I want to highlight though. So firstly is with the IMT programme, there's a much more supported transition to the medical registrar role. And we know that's something that trainees worry about. There's a more robust sort of trainee supervisor relationship. You've got protected time for certain training activities like intensive care, simulated training, and outpatient clinic. And I also wanted to highlight some of the increased flexibility in the programme. So less than full-time training is supported, out of programme experiences are supported, and Paula's going to talk to you a little bit more about that. And there's also the concept of acceleration, and that's when trainees who've done jobs in between foundation or foundation equivalent in IMT and gained capabilities during that time, they can potentially accelerate their internal medical training, and there's a process for doing that. So that's a few highlights of the programme. And there's just one top tip I'm going to give you as around your application form, and that's really a plea not to underscore yourselves. And I know we'll mention this a bit further on. So as I said, trainees last year didn't get interviews because they didn't get a high enough interview score. We don't want you to make things up. We don't want to overscore yourselves, but sometimes your achievement won't fall exactly into one of the stems when you're choosing your mark. And it's really important you don't always choose the lowest mark to be on the safe side, because that may mean the difference between getting an interview and not getting an interview. So get advice, talk to supervisors, internal medical trainee leads in your trust or your region. As I say, we are going to cover this, but it's a real plea. Just don't underscore yourselves. Don't blatantly overscore, but by just plumping for the higher score may be completely appropriate. So don't always feel like you need to jump for the lower score if what you've achieved doesn't exactly fall into one of the stems. But I'm not going to say much more than that, because we're going to cover everything in the next 4 talks. So Stephen's first. So Stephen Harding's from the recruitment office, and he's going to run through the recruitment process for you. So over to you, Stephen.
Thank you, Jane. So my name's Stephen. I'm the manager of the Physician Specialty Recruitment Office, which is based in NHS England, but we oversee the recruitment process for physician recruitment across the 4 nations. So I'm going to very much focus on the nuts and bolts of applying. I'm not going to tell you much about how you can maximise your application or anything like that, just what's involved and what you need to do. So we have a single process that covers all UK programmes. So this year there's about 1,650 programmes on offer. It varies kind of in the range of about 1,550 to 1,700 over time, but it's pretty consistent. Most regions have a similar number of programmes every single year. It covers, as well as IMT, it covers ACCS internal medicine, which is an extra year longer than IMT, but still sets you up to complete the IM Stage 1 curriculum. And not all regions have these programs, but if you are interested in those, it's a single application form, and it's just done at a later stage in terms of what you preference. So yeah, you don't need to do anything special if you're interested in ACCS IM. You only make one application, so whether you're interested in Scotland or Peninsula or anywhere in between, you just apply once. And as I said, you won't preference on your application form, you'll do that at a later stage. There's only one round of IMT. Since the competition has increased, we haven't needed a second round. So do make sure if you're interested in starting next August, do make sure that you hit the application window this year, because if you miss it, then you will have to wait another year. Pretty much all programs will start at the beginning of August. There have been the odd one that have been offered later, but it's basically everything starts in August. So you need to be ready to start in August 24. You can only defer your application if it's for statutory reasons such as maternity or ill health. So if you have something which you wanted to complete first, like a master's or something like that, you do need to make sure you are ready to start on the 7th of August, because that wouldn't normally be acceptable. There are 2 assessment processes that we have. So the first is self-assessment shortlisting. So on your application form, you will score yourself against a preset matrix, and you can see that on our website already and how many points are available for each thing. And then that is just used for shortlisting. So that score doesn't carry. And then we have an online interview which covers the various aspects that we are looking at. And we'll cover what's in the interview later on in this talk. As I mentioned, we've got the website as extensive guidance on the process. So this is what it looks like. We haven't updated it for 2024 yet, but nearly everything is the same as 2023. So if you want to start looking at it now, it won't change a whole lot. We will have it updated by the end of September. Not sure exactly when, but we're working on it now. So a complete refresh will be done then, but it's going to look 95+% the same. Okay, so talk about competition. Jane mentioned it's getting more and more competitive, and you can see that application numbers have pretty much doubled since 2019. So we no longer have the second round. And the competition ratio has gone up to 2.64 in the last round. So obviously that will, that makes it harder, as Jane said. We don't, I'll run into timeline and we'll talk about interview capacity and sort of what sort of percentage chances of everything later, shortly. So applications will open on the 26th of October, and you have until the 23rd of November to submit. We then do long listings, just making sure you meet the basic person specification criteria. Shortlisting and invite to interview happen around Christmas. So not ideal that we have bookings open over Christmas, but needs must to make sure we get everything done in time. Importantly, interviews are between the 15th of January and 16th of February, so we'd hope that everyone can make at least a few dates in that window, regardless of any holidays or anything else. And then you can see that we get outcomes in late Feb, offers in March, and we're pretty much wrapped up by early April. So it does last quite a few months, the process. All applications are done on Oriel, which is where you will apply for all specialties, whether it's physicians, surgery, radiology, or whatever. So all applications are made on the same system. So if you're unless you're a current foundation year 2 doctor, you will need to supply evidence of your foundation competence. Either that's because you've already completed foundation in the last 3 or so years and you have a certificate to demonstrate that, or you're using what's called the CREST, the Certificate of Readiness to Enter Specialty Training. If anyone is on that CREST route, just a note to say that the certificate has been updated this year, and old versions won't be accepted. So if you applied last year with a CREST, you will need to get a new version. I think most people on this call are probably current foundation trainees, so that wouldn't apply to you. Generally, you don't need any other documentation. If there might be certain circumstances, like if you have you need some reasonable adjustments, you may be asked to supply evidence, but generally you don't need any documentation at the time of application. With regards to the self-assessment, it's really, really important that you read the guidance and you don't just fill it in without reading the guidance, because some things, so we have a whole section about application scoring with each of the domains that are covered, and some sections might have notes which, if you don't read, these won't appear on the application form. So it's really important you read these to help you ascertain whether you meet that statement. So can't stress importantly enough that you can't really fill this in without referring to the website. We won't be asking you to upload evidence, but you need to be able to upload evidence if you are asked. So you have to make sure you shouldn't claim something that you couldn't produce evidence that a consultant assessor could look at and say, yeah, I can confirm that you have that. So you're not likely to have to load it at any stage during the process. You just need to be ready. One very, very important thing is no late applications, and there are no exceptions, and I mean no exceptions. So you really do need to be ready to submit. I would not leave it till the last day to submit your application. At least aim to do it the night before and earlier if you can. But you can't make changes after submission, so do make sure that you have double checked it. If you realise a mistake after you've applied, we won't be able to update the form. So yeah, I'd advise start early. It does take some time, depending on how much you want to write. I mean, there are word count limits, but yeah, depending on how detailed you want to go and how much time you want to spend, it can take quite a lot of hours. So do be prepared for that. And just make sure you submit early or earlier than the last day, because if there are technical issues, unless it's a system problem, we won't be able to help. If it's and usually if it's not a system problem, it will be a local problem. There's nothing we can do. So before the interview, as I mentioned earlier, we have long listing, so we're checking your eligibility. Most people are eligible. We only wheedle out a few at this stage, but what's really important is until we confirm long listing on, I think it's 19th of December or somewhere around there, that you are monitoring your emails. When you apply, you get an email saying that confirming your application has been received. So it's very important you make sure you get that, not so much for what it says, but it implies that you will get all other emails received during the process. If you're not, you can you do things like check your junk email, and all messages are copied to your Oriel account. So you can always check to see if you have received an email there if you as well. So monitor both your emails and your Oriel messages regularly. So when we shortlist, all we'll be doing is looking at the interview capacity and your self-assessment score, and we'll be going down to the lowest score that we can within the capacity. There is no minimum score, it's just wherever the capacity falls. Last year, we ended up inviting around 90%. So that's just something to bear in mind. We can't always invite everyone in the first tranche, but if people don't take up invites, we'll then invite more people. So I think we ended at around 90% invited, somewhere around there. As I mentioned earlier, your application score is only used for shortlisting. At interview, you will get a score based on your achievements, but we won't be reusing your application score. So invites to interview follow. You will self-book your slot, and it's a first come, first served basis. Every region across the UK is participating in hosting interviews, but it doesn't matter who hosts your interview. It has no impact on your ability to work anywhere in the country. So all you should do when you book your date is to look for the most convenient one for you, not worry about who is hosting it. So after interview, the scores are weighted to form a total score used for ranking, and you can see how we do that on the website. So it's totally transparent about how that score is done. You will get your score and your ranking confirmed, what should be on the 27th of February. Program preferences open on the same day. So this is when you choose the specific rotations that you will be doing. There are, you can choose from the whole of the UK. You don't have to choose from all of the UK. If you're only interested in staying in one region, you can do that. But if the more regions you're interested in, the more time it is going to take. And there are somewhere around 1,500 options. So let's say you were just desperate for a post and you don't care where you work. That's going to be a lot of time to sift those into order. Because they go down to rotation level, there's all sorts of things that you might be thinking about in terms of geography versus so the hospital that you're in versus the specialties that appear in your rotation. So it takes a long time. So we do give over 2 weeks to do that, and you may well need it. One major thing that we do advise is you should only preference something that you would accept if offered. If you wouldn't accept it, you're basically disadvantaging yourself, because if we offer you it and you wouldn't take it, you decline, you're out of the process. It's much better to be on the reserve list for posts you would accept. So please, 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 when you get to that stage, remember, and we will repeat this several times, only preference things you would accept. You don't need to game the system. It's very meritocratic. So what happens is the rank 1, we look at your preference 1, assuming there's a post, which you'd think there would be, you get that offer. We work down the list until we found a match for each person. If you can't be matched to a post, we go to the next person. So this means that if you're ranked 1,000th, you will have a chance at your last choice preference before the person ranked 1,001st gets a choice, gets to have any. So there's no need to think, oh, well, that region is going to be less popular, so I'll go for them because I've got a better chance. It doesn't work like that. We have at the moment on the website, we've got a document from 2020, I think it is, with some preferencing information about how you had to rank for certain regions. We haven't updated that for a while, but we are hoping to get that updated for 2023. So when you look at the data, you'll be able to have an idea about, okay, last year, if I wanted to work in London, say, approximately where did I need to rank? So that's hopefully coming soon. So offers, as I said, we use your rank and your preferences. You can't be offered anything you don't preference, and we always offer in rank order. You will have 48 hours to respond, so it's really important to be sure to know when we're going to be doing this. We send a lot of information during the process about when we're going to be doing things. So again, keep an eye on your messages. When you get an offer, you only have 48 hours to respond. That doesn't include weekends. So if we offer you on a Friday, you have until the Tuesday. And your choices are to accept an offer. You can hold it. So if you're waiting for another specialty, you don't have to. We're not forcing you into a decision right away. You can hold it while you wait for the other specialties offers to commence. You can decline it, and there you're out of the process. And then if you accept or hold, you can opt in for upgrading. So let's say you get your 50th choice program. You want it, but you would prefer something better. You can accept it, opt in for upgrades. And then when we run matches later on, if we can find you a match, you'll be automatically upgraded. It's very important to make sure your response is registered. So once you've accepted the offer, it's a 2-step process. And we have had people lose an offer because they didn't complete the second step. So it'll be very clear once you've done it, you'll get an email confirming, your status will change. Just make sure that that has happened. We offer in iterations, so we'll do one set of offers, and then a few days later we'll do the next set, and upgrades are done at the same time. So you can't be upgraded. It doesn't work automatically. It requires us to press a button, which we'll do every kind of 3-ish working days, give or take. So that's pretty much the end of what I've got to say. The interview is going to be covered by one of our other speakers, but some key messages to leave you with is to make sure you're referring to the website throughout the process. We've done a lot of guidance to help and guide you through, so please do use it, and you'll be one of the vast majority who have no need to contact us whatsoever. But saying that, if you do need to contact us, we do run a help desk, and you can send your messages to us, and we usually turn those around pretty quickly. Very important to meet deadlines. Some deadlines are set in stone, like the application. Some are, well, maybe there'd be a chance to overturn something that you've missed, but maybe not. So don't take the gamble, meet the deadline. And keep an eye on your messages. We will message fairly frequently, certainly at certain times. And make sure you don't miss anything crucial. So thanks, Jane, Nita. I'll hand back to the next speaker.
Thanks, Stephen. Hannah, I think you're next. So Hannah's one of our trainees, although you've finished our programme now, haven't you, Hannah? But she's going to talk to us about IMT from a trainee perspective. Can I remind people to add some questions in the chat as well as we go? Thank you.
See, share this window, and then, sorry, bear with me a second. Are people able to see my slides at the moment? If not, just let me know.
We can hear you, Hannah, but we can't see your slides yet.
Thank you very much. Let me sort that out. Share. Okay. Is that better?
Yeah, we can see them now. It's quite small. That's it. It's in a slideshow now, Hannah. Thanks.
Okay. Hi. So my name is Hannah, and I'm currently undertaking a trust grade registrar post in stroke medicine in London. But I completed internal medicine year 3 at University Hospital North Tees in Stockton-on-Tees in the Northern Deanery last year, and I was in the first cohort of the internal medicine training stage 1 programme. So today I'll talk about why I chose to apply for IMT, what my worries at the beginning of the programme were, and perhaps those that echo other trainees and applicants' sort of concerns, what I found have been the challenges and strengths of IMT, and my reflections on how IMT has helped shape me as a clinician. So why did I choose internal medicine training? So it wasn't until the end of F2 during my stroke placement I considered medical training. My medical placements during foundation training had been the most rewarding, albeit the most stressful. So I needed to see whether I was cut out for it and whether I was really the right fit, or whether it was the really right fit for me. Subsequently, I undertook posts as a junior clinical fellow in care of the elderly, gastroenterology, acute medicine, and specialist palliative care. And these helped to confirm my decision to apply for internal medicine training. Reflecting now, the things that attracted me to IMT included my experiences. My consultants and registrars in medicine were role models for how I wanted to practice healthcare and what I found interesting. Many of my MDT colleagues, occupational therapists, nurses, and social workers, to name just a few, have been really positive influences for me as well. My interests. So the cases I'd seen in medicine were also the ones that I was most fascinated by. Just one of many examples included seeing a patient with hyponatremia caused by a spontaneous intracerebral hemorrhage due to uncontrolled hypertension. This reflected my interests, which include problem solving and understanding the disease processes themselves. I also generally recognise that I prefer variety to keep me stimulated, and that tends to come with generalist rather than highly specialised fields. Things that are important to me include providing holistic, person-centred care, addressing the biological, psychological and social needs of patients. To do this properly requires working both within and between specialties. And I truly love working constructively together with others of different professions and different teams to make the diagnosis and provide joined up care. Finally, it's important to be honest with yourself about where your strengths lie and what you can give to a specialty. I'm somebody who's naturally more detailed focused, and I also tend to be more cautious by nature. And this means very rapid turnover settings like A&E maybe suit me less well, but also that I'm probably better working as part of a team to share risk making and decision making, as opposed to solo work, for example, in general practice. I also love learning, and while the opportunity for this is available in every healthcare setting, I think medicine offers more than its fair share. I've spoken to some of my colleagues who've also undertaken IMT or are in the process of applying, and their motivations echoed a lot of my own, not forgetting a passion for medicine. So, what concerns have myself and others had at the start of the programme? Adjusting from foundation training, transitioning into a new training programme or returning to training after a period away from it undeniably comes with a degree of apprehension. I'd been very fortunate and had an exceptionally supportive educational supervisor who knew the curriculum and my ARCP requirements like the back of my hand, like the back of her hand, sorry, and had shepherded me through. I'd also been based in the same trust for 2 years, so I felt comfortable knowing my colleagues and systems. Suddenly, I would be thrust into new teams with new responsibilities, new computer programs, and simultaneously trying to navigate a new portfolio. As someone who finds building trust and constructive workplace relationships some of the most stressful parts of the job, I was anxious about building up the courage to ask for enough supervised learning events. I'd studied the curriculum quite carefully, and looking at the list of conditions and presentations I'd been expected to cover was very overwhelming. I knew that sitting exams to obtain membership to the Royal College of Physicians would be a prerequisite of completing training, and feared the dreaded PACES exam everyone talked about so ominously. What if I got to the end of training and I still wasn't any closer to knowing what subspecialty of medicine would be the right one for me? And one of the major concerns I frequently hear about is the service provision demands on internal medicine trainees at the expense of mandated curriculum requirements and the risk of occupational burnout. So this is my personal evaluation of the challenges and the strengths of IMT. Taking on the medical trainee role is undeniably a massive step up in responsibility from foundation. And when caring for people with increasingly complex needs with chronic NHS staffing shortages, it can be very overwhelming. Frequently during IMT 1 and 2, I was the most senior medic working on the ward, supporting junior colleagues. And whilst there are always seniors who are available to contact for advice and do review several times a week, your input makes a big difference to the daily running and patient flow. These inpatient responsibilities contribute to the challenges gaining other training opportunities, namely an outpatient experience and procedural skills. There are additional barriers, including the volume of both IMTs and other training grades, for example, higher specialty trainees, who also need to gain proficiency in these areas. So I don't think this challenge is limited to internal medicine's training stage 1. Certainly compared to my understanding of how core medical training worked, I think there are many strengths to internal medicine training. Mandatory placements, including in intensive care and older persons medicine. These hone skills like recognising and managing the deteriorating patient, providing generalist palliative care, and communicating under a wide range of challenging circumstances. The formal teaching programme put together for us, both at a hospital level and regionally, covered varied and highly educationally valuable topics, provided by numerous local experts. Even on your routine medical jobs, there are infinite opportunities for bedside learning. I can say I've encountered nearly every listed presentation and condition on the job as an internal medicine trainee. I think IMT3 is one of the biggest triumphs of the programme in preparing us for the medical registrar role. Now you get a whole year dedicated to just learning how to be a general medical registrar, whilst you used to have to start learning how to be a specialty registrar at the same time. Whilst this year I've not been managing the acute unselected take, I'm certain that the general medical registrar experience I yielded during IMT3 has been invaluable for coordinating time-critical care with dynamic multidisciplinary teams and given me the confidence to care for medically unwell inpatients. Last and not least, there is an active focus on advancing non-clinical skills such as leadership and management and quality improvement. This was facilitated by formal placements on my weekly skills session in IMT3, as well as through the experience obtained without even trying as the invaluable IMT supporting the ward at large.
Anna, you just hit mute by mistake. We only missed a tiny bit.
I'll start that slide again. Thanks, Jane. So how has IMT shaped me? When I've supported current IMTs, it makes me realise how much the programme supported my personal and professional development. I've had so much experiential learning, teaching from excellent role models, encountered a wide range of pathologies, and worked with many different specialties. It was so rewarding. The objective feedback I received also reassured me that the doctor I became was leaps and bounds from the one that I started the training programme as. Our population has increasing numbers and complexity of health and social care needs, which are hard to balance. These require a generalist as opposed to single disease-oriented approach. And I feel that not only is this training programme given me the to value and enjoy general medicine far more. There are times when you might be the expert in generalism on specialty wards with the most relevant experience, for example, in approaching end-of-life care. Not all of our medical seniors have benefited from the same formal training as us. Equally, even this early in my career, I can see the evolution of medicine, which has challenged my belief that holistic care is the preserve of older person's medicine. My current plan is to apply for both acute and geriatric medicine with a focus on stroke medicine. And whilst I wasn't certain how to proceed at the end of IMT 3, I felt calm as I believe that it isn't possible to have too much experience in too many specialties to develop your competence, confidence, and compassion as a physician. The equivalent of 6 months of acute medicine, as well as the shared entrustment decision with my educational supervisor about when I was ready to act as a solo medical registrar on site, as opposed to being thrust in at the deep end as a unilateral decision, were invaluable for my clinical development and made my 15 months of internal medicine training year 3 feel like a supported step up and a training experience as opposed to a purely service provision. I started the year truly uncertain if I was ever going to manage the medical registrar role, but with the training that I received that was tailored to my individual needs and the support of second to none supervision, I achieved this goal. Finally, I've increasingly recognised others who value and revel in positions of leadership as role models for me, and I think IMT has provided me with ample opportunity to develop my own skills. On the wards, your input can be paramount to effective patient flow, setting examples of clinical practice, fostering collaborative working relationships amongst multidisciplinary teams, and being an invaluable contact for senior and junior clinical staff alike. Curriculum specified requirements off the wards, including quality improvement projects and human factors training, have also strengthened my leadership skills. Finally, I felt that to make the changes this programme is intended to achieve requires input of trainees. Amongst several things, I was a hospital representative during IMT, and being able to shape training on a local level, working with my local postgraduate education teams, yielded better opportunities for me, and I hope for my colleagues. Whilst it's not always been easy, I managed to complete the training programme despite my own challenges, and this was only possible with the compassion and advocacy of my many excellent supervisors and seniors, including my training programme directors, Jane Wallace, Anita Jones and Ben Pruden. And this drives me to try to exemplify these qualities to support others in my future teams. So thank you very much for your time.
We'll move on to our next speaker. If you have any questions for Hannah, please just add them into the chat. So Paula's next, and Paula's going to give us some top tips for IMT application. Thank you, Paula.
Hello, everyone. I'm just going to try and share my slides, 2 wee seconds. Can you hear me okay?
Yes, fine. Fine.
Okay, great. I'll just pop this in. Okay, can you see them? Oh, I need to go back to the window I was sharing.
Looks like they're coming. It's just gone. Yeah. Oh. It's come up. Yeah.
That's it. Okay, right. I'll try and put it onto the big slides. Can you see them?
Yes.
And are they large?
Yeah, they are large, Paula.
Okay, great. Okay, lovely. So I'm Paula. I'm a haematology registrar up in Glasgow. I spent most of my junior training down in Newcastle, which is why I'm doing this today, because I know the Newcastle team very well, but moved up here to start my registrar training in August. So this is just going to be a quick flick through the IMT portfolio. I think, as everyone said, the main thing about applying for IMT is to be prepared, especially now it's become more competitive. So just knowing what points are available to you and what's a kind of sensible thing to aim for is probably a good thing to do. So this is just a little bit about me. So I went to Edinburgh Uni. I graduated without honours, so you don't need to get honours to get into registrar training. And then I did my foundation training at the QE in Gateshead. Then I did a teaching fellow in acute medicine for a year. and then went straight into IMT. I actually only did 2 years of IMT, so IMT 1 and IMT 2, because I was quite interested in haematology, but wasn't totally sure between haematology and palliative care. So I then took a year out to do a specialist like trust grade post at the Newcastle Centre for Cancer Care in haematology, which was great, and then got my registrar number, and I've moved up to Glasgow. So you don't have to take a linear path through training. It's okay to take days out and years out if you want to. It's good to get a kind of breadth of learning. So this is the application scoring for 2024. It hasn't changed since 2023, and actually since I applied, it's exactly the same. So as everyone said before, this is just for your application. This won't then be scored for interview. So these points are really important to get you the interview in the first place, and they're then useful to discuss in your interview, but this score then won't matter after you've got your place at an interview. But it's important to try and get as many points as you can to get the interview in the first place. So I've split the points into time consuming and not time consuming. Some of you might already have the time consuming things. If you do, well done. There were some things that I just looked at and thought there was no chance I was going to get them. So these are things that are more time consuming but are worth some points. So postgraduate degrees, unless you've got a lot of money to spare and a lot of time, it's very unlikely that you're going to get a master's or a PhD. Intercalated degrees now don't count, unfortunately, for postgraduate degrees at least. So this is just masters and PhDs. So unless you've got a lot of time, or you've done one of these through your undergraduate training, which some of you might have done, it's probably not really worth doing one of these. Importantly, the postgraduate diploma, sometimes through a teaching year, you'll get a PG cert in medical education. That needs to be complete for this to count as a point. So if you're halfway through it, it doesn't count. And also, if you get a teaching postgraduate certificate, you can't count it twice. So it'll count for teaching and training, which we'll come on to. So just an important thing, if you're thinking of doing a PG cert, it needs to be complete. So say you were doing a PG cert in F2 and applying in F2, that PG cert unfortunately won't count for that extra point. You would need to use it if you are then applying in F3 once the postgraduate diploma is complete. Prizes and stuff, if you got them at uni, again, congrats, that's great. But if you don't get them, that's okay. You can still get into registrar training and still get into IMT. So you'll get points for if you've had an honours or distinction, you get 3 points. If you've got a national prize related to medicine, you get 2 points. Or if you've got 1 or more prizes or merits related to parts of the medical course, then you can get 1 point. They will check this. So if you got a merit, but they awarded it to 35% of your cohort, that won't count, and they will ask for evidence of that. So make sure that you don't overclaim for prizes and merits, because they will ask for it to be evidence-based. So it needs to be within the top 20% of marks for prizes and distinctions, and for distinction for your whole medical qualification, so honours, needs to be the 18% of the year, so top 18%. Publications, time-consuming, arduous, stressful. Great again if you've got them, but actually it's a lot of work to actually not often get a huge amount of points. So if you do a case report or a review, that's sometimes a bit easier, but again, it's 3 points and this can often take months. So I would say it's great to get involved in research and publications, especially if that's something that you're interested in, but I wouldn't bank on this for points. I would do it just to pick something that you're interested in, even if you think it's going to take a bit of time, and that then gives you something to discuss in your interview. But don't rely on these points, because often people who've been through the application process for publications, you will get knocked back from a lot of journals. So when I was applying to SD3, I had a letter thing that I submitted to a journal, and it kept getting bounced back until like 5 days after I'd applied for SD3 when it got accepted, and it didn't count because it was 5 days after I'd applied. But then I could discuss it in my interview. So it's not worthless, it's just don't count on it for points. Do something that you're interested in. These points are more realistic. These are things that if you're organised, you can definitely get them in time for applying for IMT. So presentations, definitely doable. There will be loads of local or regional meetings that you can get involved in. So speak to your consultants on the ward, speak to the consultants of the specialty that you think you might be interested in, see if they've got a local meeting just in the hospital, or often they'll have a regional meeting where you can present possibly a case that you've been involved in, or maybe if you do an audit that's interesting, then you can present an audit at one of those meetings. So aiming for an oral presentation at a regional meeting is totally doable. Similarly, aiming for a poster at a national meeting is again doable. So say you did a good audit, there's lots of like quite junior focused society meetings. So like the British Geriatric Society has got a meeting where you can present posters. The British Society for Haematology has got an annual meeting. Most specialties will have an annual meeting where you can submit audits for presentation. It's worth doing it. You'll not lose out anything, and you often don't have to pay to submit them. So worth doing it because you can get 5 points. These count once. So say if you've got a poster at a national meeting and an oral presentation at a regional meeting, it's not 10, it's unfortunately just 5. So you kind of have to go for the one that you can submit both as evidence, but you'll only get 5 points for one. Training and teaching, again, this is very doable, especially if you're going to take time out between foundation and applying to IMT. As I've said before, the PG cert does not count unless it's complete, but the e-learning for health modules do count. You could get them as 1 point, so that would be training and teaching, which is below the level of a PG cert. So there'll be some training the trainer like module things on there, so you can just do those, download the certificates and upload that, and that should count as 1 point for your training and teaching. PG certs count as 2, masters count as 3, but PG certs you'll have to have completed before you get that extra 2 points. It's worth doing though if you're thinking about it, because then these points are very similar to the registrar application. So if you do a PG cert in F2 or F3, you don't get the points for applying for IMT. You will then get those points when you apply for registrar training. So it's worth thinking of IMT, but also thinking ahead to registrar training as well. Teaching experience, you can definitely do this, absolutely. If you're organised, you should be able to get 6 points, because often there's a gap for teaching, whether it's teaching medical students or doing teaching within your department. If you just organise a teaching programme and then set it up over a period of 3 months and get some feedback from people, so feedback from the people that you've taught and also feedback from the consultants, then you'll get 6 points. It should be doable, even if you're not organising. It just says regular. So regularly taught, they don't define what that is. So that could be once every 2 weeks, once a month for 3 months, like, or you've organised it. Just do something. It should be doable to do this. If not, if you've taught medical students that come on the ward for a period of 3 months or more, then you should definitely get some feedback from those medical students and from a consultant. It needs to be formal feedback. So the GRCPTV have got teaching feedback forms on their website. I just recommend having a stash of them in your bag and then just giving them out to medical students, or you can make an online form for them to fill out, but generally it's easier if you just get them to write it down while you're there, because if you send them a link the same way that we all do, you just won't fill out the feedback form. So just kind of make sure that they do it at the time. Just get the feedback. This should be easy points. And the QIP quality improvement project, I know it's a pain, but it's useful research for the department, and also it's good for you to do some. Again, for all of these things, I would stress do something that you're interested in. For a quality improvement project, it depends on how much you've managed to do for how many points you'll get. Really, if you do a quick quality improvement project, it's not unreasonable that you might be able to do 2 cycles of a QIP, and for a cycle of a QIP you basically need to have done audited it, found something that's wrong, implemented a change, and then re-audited it. So that should be doable within a year if you're at an F2. If you're an F3 as well, you should definitely be able to do it before you apply. Obviously applying kind of early in the year, you need to be thinking of doing it the year before you're basically applying. So add to the quality improvement project, which I started in the, what year, when did I start it? In IMT2. I started it in the February of IMT2, finished it by the July of IMT2 to then use it for my registrar application and get the points for 2 cycles of QIP. So it is a bit of a long haul, but as long as you're prepared to get it done in cycles, you should be able to get 5 points. And these are really good things to talk about during your application. So having a good quality improvement project is really important. leadership. Local reps count, so 2 points for maybe being the mess president or like being in the junior doctors rep for the FY1s or something. So it's worth taking on one of those roles if you feel that you've got the time to do it and not get too stressed out by it, because actually it's 2 extra points and makes it easier for your application. National or regional leadership is more difficult to get, but things that you've done in the past, so it says there like charity, scouting, guide, sports, creative arts at a national level, things that if you've done anything like that in the past, just make sure that you dig that out and you can use that as national, regional leadership. But probably local leadership is something that you're more likely to be able to get. So that's a kind of brief rundown of the application and what points you can get for your application. If anyone's got any questions, obviously just drop them into the box. I can't see that at the minute, but I will reply to them after. But what's after IMT? You've got options basically. You're not stuck in IMT, which is some people feel that once you get onto the road of being an IMT, you have to just go straight through and go into registrar training. But I think a lot of us who are here tonight haven't done that. We've not all gone straight into registrar training, so you can do IMT3. IMT3, especially in the Northeast, is great. It offers lots of you get a day a week to do something that you're interested in. There's a variety of specialties in different hospitals. It's not the same across regions, and certainly it's not the same in Scotland, which I've found out since I've moved up here. So maybe if you're thinking of IMT3, find out what IMT3 is like locally to you and see whether or not it's something that you would want to pursue. But definitely in the Northeast, it's very good. You can go out on an UPP, which is what I did. So basically, because I wasn't sure what I wanted to do, and I didn't want to do IMT3 because I wanted to do pure haematology for a year, I went on an UPP, which basically meant that I kept my training number just in case there were any issues with me liking haematology and I wanted to get back in. I got my revalidation done through HENI, so I didn't have to worry about all of that. Kept my portfolio because I was still an IMT technically, and then just worked in a job that I was interested in for a year. If you're going to do that, you have to have a job lined up. So it's not, you can't just do it and go and locum and then come back into IMT3. You have to have like a specific role lined up, I think. But Dr. Wallace and Dr. Jones will be able to kind of clarify that, and if I'm wrong in that respect. You can do ST3, so Group 2 specialties exist. Shout out to haematology and oncology. Haematology is a Group 2 specialty, which means that you don't have to do IMT3 because we're dual accredited with the Royal College of Pathologists. And we do pathology exams, so we don't do the general medical take, and we just do haematology on calls. So I started my first on calls last week. I was in my bed, which was quite nice. So that's one of the benefits of doing a Group 2 specialty. I did get phoned and woken up, but you're not in the hospital, so it's a bit easier in that respect. If you want to have a break, that's fine. It's intense and hard working. So if you want to go to Australia or you want to take some time out to do something that you're interested in, that's completely fine. You're better to go into registrar training feeling ready and prepared and that you've got everything out of the way, because once you start registrar training, that is a sort of you've committed yourself to 5 years of training at least. So it's good to make sure that you feel ready. The joy is that you don't get penalised, so the poor surgeons get points divided every year that they take out. IMT into registrar training, you don't, so that's good. And as I've said before, the SC3 application scoring is very similar to IMT scoring. You get points for MRCP when you're applying for registrar training, so that's not something to think about now, but it's worth trying to get your MRCP done before you're applying, so that you can get the points. And there's also additional points for commitment to specialty for registrar training. So you can build those points up over your IMT years by just taking part in projects, attending conferences, doing presentations of things that you're interested in, teaching programs of things that you're interested in. All of those will give you commitment to specialty points. And there is a slight change to the QI scoring, but that's not worth knowing about, really. So yeah, I think what everyone said, start preparing early, be tactical. There's easy points that you can get if you know about them. You just have to know about them early and prepare. That's a link to the scoring criteria. If you wanted to have a look at it yourself, it's very clear. And if you do have questions, you can get in touch with the college. They'll tell you, the GRCPD. Make sure you've got the evidence to back up your points. So because they will check it and they'll ask you for certificates to show your merits and whatever. They'll want presentation certificates. So make sure that any presentations, things that you do, you get evidence of it. But equally put stuff in that isn't worth points, because then you can talk about it in your interview. In my ST3 interview, I included the publication that I hadn't had published by the time, so I got no points for it. But then they asked me about it during my interview because they can see your application. And we've talked about it, your application score only gets you the interview, then the points are null and void. So it's good to do things that you're interested in, because then you get to talk about it in your portfolio, in your interview. And if you're enthusiastic about it, it'll be easier to do your interview and your enthusiasm will shine through. So good luck, everyone. I think that's everything from me. I'll see if there's any questions in the chat, but have I stopped sharing? I think so.
Yeah, you have.
Yeah, I'll exit now. Great.
Great, thank you, Paula.
Anissa,
Stephen, you've got your hand up. Go on.
Yes, yeah. Just before we move on, so just to say that the application scoring, we haven't 100% confirmed it for 2024, but it's going to be really similar to 2023. It's possible some of the notes may be clarified to try and make it clearer about what qualifies as what, and it's not likely the options are going to change. But just keep an eye on the website over the next 3 weeks. We will have it updated by the end of September, but any changes will be really minor. Next year, we are considering maybe making some more substantial changes, but we will, our aim is to try and, by the end of this calendar year, to be clear about what changes would be coming for 2025. So 2024, you can pretty much look at it as it is now and be comfortable with it. 2025, keep an eye on the website towards the end of the year. And I would say on the questions, I'm working my way through them. There are some which are kind of not really, they're more about how do I evidence this or what's a PDSA cycle. So I'm kind of leaving those if some of the doctors can maybe come in who are better placed to advise on those. Thanks, Anita.
Thanks, Stephen, and thanks, Paula. So yeah, keep putting the questions in the chat. We'll carry on with those. And Lydia, thank you, our final speaker today. Lydia is going to talk about the IMT interview.
Lovely. Let me just find my slides. Can you see the slides now or not?
Yep.
Yep, here.
Oh, they've gone away again now. Yep, they're back, but it's not in a slideshow format at the moment. That's it. Perfect.
Is it now? Amazing. So hi everyone, I'm Lydia. I am one of the IMT2s currently working at Durham, and I'm going to be talking to you about the interview process, which, as some of you might know, changed last year to being sort of proper online interviews, and that's how it appears to be staying. So I'll be talking through how to prepare best and what, generally speaking, the interview will entail. So to start off with the interview structure, so it has 3 main components, which I'll run through briefly now, and then I'll go into more detail. So the first section is the application and your suitability to IMT, which begins with a 2-minute presentation that you would give without any slides, followed by 4 minutes of questions. And that would broadly be covering your career to date thus far, what your future plans and aspirations might be, any achievements that you've mentioned, positive feedback you've received from seniors, from patients and families. And really key for answering this section is looking at the person specification for IMT and what the IMT training goals are and trying to link those up, which I'll talk through more in a little bit. And then you'll move on to the clinical scenario and handover, which is probably the section that I think most people feel the most anxiety about. And that begins with 3 minutes of reading a vignette, followed by 8 minutes of a clinical scenario, which you'll be talking through with the interviewer. It's not an actual role play, and you'll just be guided through questions about how you would approach that patient, what questions you'd ask them, how you'd investigate them, what your differentials would be in your treatment. And then you'd have a 1-minute handover to the medical registrar or a senior in the hospital. And then the final section of the interview is ethics, professionalism and governance, which is around about 5 minutes, which is usually a case-based discussion with the interviewers, followed by questions. So the logistics of an online interview. So you can be interviewed anywhere in the UK. You don't need to be interviewed in the deanery where you're currently working or where you'd like to have your future job. You can choose anywhere you want. Some people feel very strongly that they want to be interviewed in a particular place, but it doesn't affect what your overall job would end up being. The interview dates tend to be released around the end of January, sort of around the 21st of December. So just probably worthwhile having a look at what you're doing on the day they're coming out, if there's a particular date or place that you want to be interviewed, just because you'll have to sign up for different times on a certain day and they can get booked up quickly on sort of popular days. The interview itself will be with 2 clinicians, and there'll also be 1 member of the admin team there as well. They're not there to ask you any questions. They would be there just to do timekeeping, and they can be quite firm with timekeeping. So when it says a 2-minute presentation, they will tell you to stop at the end of the 2 minutes. It might sound a little bit silly now with how much time we spend on Microsoft Teams, but before you have your online interview, it's definitely worthwhile just familiarising yourself with using Teams. I had a little practice interview with one of my friends, made sure I was comfortable clicking on the link, checking that my Wi-Fi was strong enough, I wasn't in a buffer, that my microphone was working, and then just make sure you've got somewhere that has a nice plain background and somewhere quiet. So hopefully you won't be having to do your interview at work, but if you are, make sure you found somewhere, a nice quiet room where you know you're not going to be disturbed. So we'll start with the first section of the interview. So this is the application and suitability for IMT. And if you look on the IMT website, they describe this section as giving an overview of your achievements to date, which are most relevant to your application to be a trainee in internal medicine. So basically, it's 2 minutes of selling yourself to the interviewers as that you are a good candidate for IMT and that you have done X, Y, and Z, and this is why you will perform well in internal medicine. So 2 minutes obviously isn't a very long time at all, and you can't use a PowerPoint. So it's just going to be 2 minutes of you talking and presenting to the interviewers. So I would try and think of a clear structure. You obviously can't cover all of your achievements to date. So try and think of what the key things that you want to mention are. I would present imagining that they've never seen your oral application. So don't feel that you can't mention something again because it's already on your application. If there's something that you're really proud of and that you think really makes you stand out as a candidate, feel free to hammer that point home. So what I would do when preparing for your presentation is I'd go have a look at the IMT person specific specification, which I put a link down here, but if you just Google internal medicine training person spec, it tends to come up on Google. And then that will tell you all the key skills that people are looking for when they should be applying to IMT. So I've just picked out the academic skills section that you can see here. And this mentions the essential criteria they want in trainees as well as desirable criteria. And from this, you can see that we want someone that demonstrates understanding of research, quality improvement, someone that has potentially been involved in publications, they've won prizes, they've got extra degrees, and they're showing an interest and a commitment to the specialty beyond the mandatory curriculum, and they've also got evidence and interest and experience of teaching. So that would be some key points that you could pick out for the ones that are applicable to you. So have a look through your application, think about what makes you unique, what makes you good, and then I would base your presentation around that. So I would say examples of what I would cover, and I don't think you could probably fit all of this into 2 minutes, so you probably just need to think about what your key points are going to be, would be a very quick, brief introduction to yourself and your career to date. I wouldn't spend too long talking about the different jobs that you've done in foundation. Then mention any audits and research projects that you've done or been involved in, any presentations, especially if they're at a national or international level, any teaching, leadership roles you've held. If you've taken years out of training, what did you do? What did you learn from them? How do you think that's made you a better doctor or more suited to IMT? Any prizes you've received, or even any excellence reports that you've received working in your trust, any positive feedback you've received, And then also anything that you've achieved outside of medicine, because you want to show that you're a well-rounded individual as well, and then try and link that back to how that makes you a good doctor and suited to IMT. I think often you can see a list like that and think, I'm just a normal person who doesn't do presentations, hasn't done extra degrees, and feel a bit intimidated that some people are going to be coming with lots of things to say. But just try and remember that they're expecting you to be at the level of an F2. So they're not expecting you to have had years out where you've done, different degrees and fellowships. All of you should have something to talk about. So all foundation doctors should have done a QIP. So you should have a QIP that you can talk about. All of you should have completed a teaching sign-off for your portfolio as well. So that's easy for you to talk about. And I'm sure lots of you do things outside of medicine as well. So you can easily talk about those things as well. I would just make sure if you are going to talk about a presentation or a research project you've done, make sure that you've had a proper read of that before you start talking about it, because you don't want to be caught out by them asking you further questions about something that you can't quite remember the key logistics of it. So following that talk that you give, you'll then have 4 minutes of questions. They can ask you anything they want, so they can pick up on achievements that you've briefly mentioned and ask you more details about them. So I think that's why you don't need to go into too much detail in that first 2 minutes. I think a really obvious question that they're going to ask you is, why have you chosen to apply for IMT? And I think that's often quite a hard question to answer, because you might just never thought exactly how you would present that. So definitely try and practice that with your friends if you can. Think about, was it, talking to your seniors about internal medicine that's made you want to apply? Is it a taster day that you've done? Is it a quality improvement project in a certain specialty? Or have you been to a conference about it that's sparked your interest? So just try and practice that question and think of how you would describe why you've applied. They might also ask you about future plans and if you have any career plans. I think it's absolutely fine if you don't have a chosen specialty in mind already, but just think about, why is it that IMT appeals to you? Is there a particular career path that you would choose to consider at this time being? It's fine if that was to change. I'd go and have a look at the IMT curriculum, which is on the Royal College's website. It's just a very brief overview. You don't need to know it inside out, but you probably should be aware of what you would be undertaking for the next 3 years. So IMT curriculum is broken down into these things called capabilities in practice, which is how you sort of fill in your portfolio. So it might be worth just having a look at, broadly speaking, what some of the capabilities in practice are. So if they ask you what the curriculum's like or what you'd be needing to do over the next 3 years, you've got a vague idea. And then just try and think of examples for leadership, teamwork, prioritizing time, ethical dilemmas, and dedication to specialty, just in case they ask you for one of those if you haven't had time to mention it in your presentation beforehand. And I think there's quite a lot of good sort of medical interview textbooks that would, sort of books in the library at work that would cover these sorts of sections if you're looking for some ideas. So following those 4 minutes, you'll then move on to your clinical scenario, and this begins with 3 minutes of reading and preparation time. So the vignette is typically quite brief. It might just be a couple of sentences, and it would usually be covering sort of an acute medical issue. So for example, it might say you're an SHO on the respiratory ward and you're asked to see John Smith, who's complaining of chest pain. So you then have obviously a lot more time to prepare. So you're allowed to make notes. You obviously can't Google or use your phone, but you can make notes, and I would suggest that you do, about, broadly speaking, how would you investigate manage that, just in case your mind goes blank at any point. I think this is a scenario that you just need to keep practicing lots and lots of times, and that's probably the best way of dealing with the anxiety around sort of being put on the spot managing a clinical case with 2 consultants watching you. So just practice with your friends, with your colleagues as much as you can, and that probably will get you the most preparation you need. During the actual interview, you'll just talk through the case with the interviewer, and they will guide you through the case. So you'll never have to actually speak to one of them as if they are the patient, and they will ask you what further questions are you going to ask the patient, what your investigations would be, and typically they will show you something that needs to be interpreted. So they might show you a set of bloods, they might show you some imaging, they might show you an ABG, I don't know, like an LP result, and they would ask you to interpret that. So just make sure you're not completely surprised by that answer. And also that's probably why it's a good idea not to do the interview on your phone, because if you're trying to interpret a chest x-ray on your phone, you probably are going to struggle. And then they would ask you about your differentials and your treatment. At the end of that scenario, you'll be asked to hand over your patient to the medical registrar. And I think this is something that you might think is quite an easy part of the scenario, and you only have a minute to do it. But when you look at the marking scheme for the clinical scenario, half the marks are for your investigations and your management, and the second half of the marks are for your handover. So you really want to make sure your handover is slick and that you've practiced that part of it as well. And then the final part of the interview is your ethical and professional section. You're not given any time to prepare for this question. They will give you the case and they will start asking questions about it straight away. I think there's probably 100 different things that they could cover, but I think broadly speaking, the key topics are going to be consent, best interest decisions, confidentiality, mental health, and sort of resource allocation. When I was preparing, went to the library at work again, and I just got out sort of a couple of medical ethics textbooks just to refresh my memory on how to approach these cases. For things like consent, mental health, I just check that you're aware of sort of what the law is around those issues, just in case you want to quote a piece of literature when you're describing how you would approach that case. So definitely just make sure you're aware of the up-to-date new laws regarding them. And again, just practice the scenarios with your friends. I'd practice one scenario for each of those key topics, and that would probably be enough preparation that you need to do. So just to summarise, my top tips for the interview would be just checking your internet connection and your microphone before the day. It's just one less thing to be stressed about. Have a practice interview on Teams. Even if you feel silly doing it, just do it with one of your friends just to check you're happy with how it would work. Reread your oral application prior to your interview, just to make sure if they do ask you something that you've put on your application that you're not surprised and put on the spot because of that. And don't be afraid to keep mentioning things that are already on your application. Act as if they've never seen it. And don't be scared to really sell yourself and promote yourself. And then have a look online on the IMT recruitment website. There's a really helpful section on the interview structure, and it has lots and lots of information about what to expect. And then finally, just please reread the person specification for IMT, because I think that's probably going to give you the best advice that you need for how to structure your presentation on yourself. So that's the end. Are there any questions at all that haven't been answered?
Thank you very much, Lydia. That was great. Stephen, you've got your hand up again.
Hi, yes, that was great. But there's one thing that Lydia wouldn't have known about. So a slight clarification is probably most regions won't be using Microsoft Teams as their delivery method. But from your point of view, practicing on Microsoft Teams will be just as good. So making sure that you can get yourself across in a video format, it doesn't matter what we use, it will be kind of the same, and there's similar kind of ideas about having a sort of plain background, making sure your microphone and camera are all working. That will all apply, but probably you won't have Teams. It might be used in some instances. The system we will be using integrates the scoring system that assessors use with video, so you'll get instructions about how to join your interview. I think as it stands, there isn't a blur background feature on that, but that may be coming in future. So if you do have some strange things behind you that you don't want to distract the interviewers, that's something you can prepare before the day. But I think you'll be sent like a link and you'll be asked to do a kind of diagnostic test to make sure that you're okay and you can log on all right. So just make sure you follow any instructions given to you. But as Lydia says, practicing on Teams will still be really good practice, because a video is a video at the end of the day.
Thank you, Stephen, for clarifying. Thank you to all of our speakers as well for excellent presentations, and a especially big thank you to our trainees for joining us and doing those talks for us today. As I mentioned at the beginning, this has been recorded and will appear on the JRC-PTB website. There's lots of other information on the JRC-PTB website as well, and on the IMT recruitment website. We've been referring to it all the way through the chat to answer lots of your questions. So please make sure you look at the website when you're applying. And thank you all for joining us, and really good luck with your applications. We hope to be working with you in future years in IMT. I'm not sure if there's anything else any of the other speakers want to add. If not, we'll call the meeting to a close. Is there anything else anybody would like to add?
So I think we have answered all the questions as we've been going along. I've had a squiz through and I can't see any unanswered questions. So unless anyone posts something very quickly, we'll assume everything's answered. So we'll just I'm just going to have a quick squiz now.
I think somebody's asking if the chat is going to be posted as part of the recording. I'm not sure we're able to do that, unfortunately. But as I mentioned, we have been just quoting the recruitment websites all the way through. So all the answers will be there on the recruitment website. And there's a couple of questions. One about CREST forms. Stephen, I don't know if you want to. I didn't know there were different types of CREST forms, so I don't know if you'd like to answer that.
I mentioned earlier, so this is for people coming from the non-UK foundation route, and I mentioned earlier that there's an updated version. So the last one was 2021, which was identical. Was equally usable over the last 2 years. There is a 2024 version. I'm going to post a link shortly, and you do need to have that one filled in. So 2021 versions won't be accepted. So bear with me and I'll post a link to that.
Thank you, Stephen.
Couple of other things coming in. There's a few questions about specific scoring, and you'll be seeing we're just referring you back to the scoring system. So if you're not sure about what you should score, you need to go to the recruitment website, and there's more information. It's really hard for us on this sort of format to give you specific advice on what you should score. There is a question about, is it important to sell yourself in the white space, or is it just to validate the points? So the most important thing is to validate your score, but also your interviewers will read that. So if you've got room, absolutely use it to sell yourself, and your interviewers will also use it to guide the interview and to assess things like your commitment to specialty. So yes, try and sell yourself as much as possible in the space you have. As Stephen says, there's not huge amounts of room because interviewers have to have time to read it.
Thanks, Jane. There's a question about planning to apply for in 2025, and will things have changed significantly in terms of what you get points for? I think they haven't changed that much over recent years, so I would just look at what you get points for now and just aim for that. It's difficult to say what might change in the next couple of years, but there's not been that many changes, so I just aim for things as they are at the moment.
Yeah, Anita, we'll publish as soon as we've got a few areas to work through, but as soon as we are able to publish something, we will. It's just something to say is just because an area isn't scored doesn't mean it's not important. Okay, it may not help you get to the interview stage, but there are lots of things that you can mention at interview that don't score points, which are equally valuable. So yeah, the point scoring is reflective of what we want to see from people who want to be physicians, but there are many other facets, as Lydia mentioned, about the person specification. So you know, it's not all about the points. Doing these activities will be their own reward in many other ways.
Yeah. And Stephen, you posted a comment on parts of the membership on that account, and that isn't scored, but of course it does show commitment to specialty. So all these things get credit in interview.
Thank you all. I think we should draw the meeting to a close. As I said, there's lots more information on the IMT recruitment website, so please just refer to that. But hopefully we've covered all of the questions. We keep covering all the questions and then a few more come in, but yeah. I think now might be the time to stop, if that's okay with everybody. So thanks again to all the speakers, especially the trainees, and thank you all for joining us, and good luck with your IMT applications.
Bye.
Bye-bye.